Welcome to Talking Point from the Church's Fellowship for Psychical and Spiritual Studies.
Theological Perspectives on Possession. Michael Perry. Based on a paper read on the 26th of April 1989 to a conference on casting out demons, organized by the Sunderland Health Authority Mental Health Unit. Reverend Michael Perry was the Archdeacon of Durham and editor of the volume entitled Deliverance, by the Christian Exorcism Study Group. This article may reflect the language and attitudes of the time in which it was written. Responsibility for opinions expressed herein rests solely with the author, and such opinions must not be taken to represent those of the CFPSS. Note the plural, theological perspectives. No getting away with the fiction that all students of religion, let alone all Christians, think alike. Look, for instance, at this quotation from Don Basham's Deliver Us from Evil for an extreme example. During my stay in Harrisburg, we ministered deliverance in Jack's home to a young man named Jim. One evil spirit proved most stubborn. Its name was Insanity, and it screamed and raged and swore. As we gave the repeated commands for the demon to come out, Jim fell on the floor and began to retch. As we dragged him away, the demon within him began to scream, "Leave me alone." Can human beings be possessed by alien intelligent entities, or is it all in the mind? The example I have just quoted comes from a source which clearly believes that evil spirits with known names can take up residence in the bodies of their victims and can displace their normal minds. It is the theology of charismatic pandemonium. Charismatic, because it is characteristic of that branch of the Church which emphasizes the charismata, or spiritual gifts, promised to Christians, and pandemonium, because it describes the belief that the world is crawling with demons like a 10-day-old corpse is crawling with maggots. Contrast that with the view accepted by the Presbyterian Church of Scotland in 1976, that exorcism effects nothing that cannot be accomplished by the expeditious use of medical and pastoral skills. Two very different perspectives. But a perspective is what it looks like from a viewpoint, and we need to look carefully at the viewpoint if we are to make some sense of the perspective. My perspective comes from an Anglican viewpoint, and its most recent authoritative expression is in the 1988 report of the Lambeth Conference of Bishops of the Anglican Communion, which advised the bishops to provide and oversee ministries of deliverance from demonic oppression where this is needed, and, where appropriate, with medical consultation. That echoes the advice of the Church of England bishops in 1975. They pointed out that deliverance ministry needed to be done in collaboration with the resources of medicine. The Methodist Church took the same line in 1976. Exorcism can be contemplated when applicable, but it should only be considered after a thorough pastoral investigation and in close collaboration with suitable persons qualified in medicine, psychology, and the social services. In other words, possession is a possibility and exorcism is a permissible form of treatment, but as a last rather than a first resort. First, consider the medical, psychological, psychiatric, and social aspects of each individual case, as well as the spiritual history of the patient. That is my perspective. What is my viewpoint on theology, if that is how things look like to me? It starts with the doctrine of creation. God has made this world, and He has made it in a particular way and not in any other. It is our business to find out what that way is. That is what science is for. So, when we are discussing possession, psychology and medicine will be among the scientific disciplines we need to take seriously. We will, of course, have to be critical, but if we neglect what these disciplines have to tell us about the human mind and the things that can happen to it, we are not likely to get to the truth. So we had better look at the phenomenon of possession through secular spectacles before we try to frame a theology to account for it. And we need to look not only at the sciences of medicine and psychology. As happens so often, the data of parapsychology can give us some important clues to help us come to a decision. If possession is the endpoint of a wide spectrum, what conditions lie on the way towards it? It is certainly true, for example, that one human mind can be controlled by another human mind. Think of the parent who manipulates and controls even the grown child. Think of the demagogue, Adolf Hitler, or sect leader who enslaves his followers and limits their freedom of will. Remember Jonestown? Look at Foley's Ducks, where a couple go off into their own private world, and each of them so reinforces the fantasies of the other that, in the end, reason has completely abdicated. In cases like this, it ends up by one person's mind being so enfeebled that its willing and thinking is no longer its own, but the willing and thinking of the other, controlling mind. But none of these cases can properly be called possession. They are cases of excessive influence, perhaps of a hypnotic or post-hypnotic kind, but the mind of the possessor remains with the possessor. It does not move into the body of the possessed and take up residence. Can we find better parallels to the concept of a person's mind being taken over by an invading, or even invited, entity? Maybe we can find what we are looking for in psychic sensitivity. In mediumship, for example, the sensitive, often in an altered state of consciousness such as trance, ostensibly speaks and writes, not of her own volition or on her own behalf, but as the voice or with the pen of a control. The control is a discarnate human being who temporarily takes over the voice or the hand muscles of the medium, and who is temporarily in charge of the body from which the conscious mind of the medium appears to have withdrawn for the time being. The sitter hears words, or sees writing, spoken by the mouth or written by the hand of the medium, but it originates in the mind of the control. When the medium regains a normal state of consciousness, she often has no memory of what she said or wrote during the period when she was in trance. Her body has been possessed by the control, her mind has been displaced by the control's mind. But it is only temporary, and the medium decides whether or not to go under control. A similar, but more recent, phenomenon is the vogue known as channeling. Here, the control is exercised, not by a human discarnate, but by some superhuman being, which passes on words of wisdom and guidance for the assembled disciples. Some favored channels find they can earn a great deal of money by the exercise. Things, of course, are not always what they seem. The interpretation of mediumship and channeling is still hotly debated. Are they examples of the invasion of a human mind by an alien intelligent entity, or can they be explained in terms of abnormal psychology? The odd phenomenon of multiple personality is relevant in this regard. Perhaps one of the best-known cases of this is the story of Chris Sizemore, Eve, of the book The Three Faces of Eve, by psychiatrists Thigpen and Cleckley. Chris's personality alternated between two totally opposite characters. One was sober and the other ebulliently extrovert, but neither character could remember anything that the other had done, so that Chris had great amnesiac gaps in her life. Her doctors were able to fuse her two faces into a third, and thought they had effected a cure. In fact, it subsequently transpired that a great gamut of other subpersonalities had to surface, and the traumas arising from early childhood unhappiness had to be dealt with, before Chris could be put together again as a stable and healthy character. So, is a medium nothing more than a person capable of switching subpersonalities on and off at will? Stephen Broad argues that the study of phenomena like Eve gives us better reasons for treating mediumship as one of many possible forms of dissociation, whilst Scott Rogo intriguingly stands the same idea on its head by arguing that the psychological abnormalities themselves may have been caused by the activity of invading spirits. My own stance is to be skeptical of channeling, but more ready to accept some mediumistic phenomena at face value. Some, not all. I want to be very critical and exhaust all the normal explanations first, but I believe that, at least some of the time, even when all non-paranormal interpretations have been canvassed, some mediums do seem to me to be in touch with intelligences which are no longer earthbound. I believe this because I know that telepathy can take place between human beings, and because I believe that the death of the body does not mean the end of the personality. A belief system which finds room both for discarnate humans and for telepathy can also find room for a positive evaluation of mediumship when the evidence demands it. But Chris Sizemore has at least introduced us to the possibility that a person may be possessed, not by an entity from outside, but by a detached piece of that person's own psyche. Multiple personality is an unusual phenomenon. Most cases of possession seen by psychiatrists are, in fact, examples of more common and well-understood psychiatric dysfunction. Many illnesses can include the conviction that the patient has been taken over by alien entities. It can happen in schizophrenia, or as part of an organic or depressive psychosis, or in hysterical neurosis. The psychiatrist who found out that all the devils who were afflicting his patients were allergic to thorazine, and that a course of that medication was more effective than any amount of exorcism, had a very valid point. Even more common than these illnesses is the mechanism known as projection. This is what happens when there is an unacceptable part of the personality which has been repressed into the subconscious. The only way in which it can get out is by masquerading as something other than a part of the patient's own psyche. This may be the explanation of why some people who play around with the Ouija board get into deep trouble. The unwary dabbler has repressed certain secret wishes which are too threatening, too frightening, to own. Only if the censor between conscious and subconscious can be bypassed can the repressed material come into the open. But it has to come out, not in its true colors, but disguised as something belonging to an outside entity. In that way, its shocking suggestions, or its unacceptable blandishments, or its emotionally overloaded ideas, do not need to be owned by the person who is operating the board. "It wasn't me," said the disturbed teenager, who wanted to commit suicide. "It was the spirit of my dead grandmother. She wrote on the board that she was missing me so much and wanted me to come and join her." If projected material like this can be recognized and dealt with, then the client is going to be a lot healthier. But it is a delicate and skilled job. The Ouija board, which lets repressed material out in a situation where there is no trained and knowledgeable counselor at hand to deal with material with which the conscious mind cannot cope, is an instrument of dangerous folly. Many cases of apparent possession may be of a similar nature. In these instances, the client is possessed, not by an external evil spirit, but by aspects of his own personality which are unrecognized as such because he is emotionally incapable of recognizing that he is the kind of person who can have such shocking desires. And if we are to deal with a client like this, we do not exorcise a spirit of envy, or a spirit of murder, let alone such an unlikely creature as the spirit of insanity with which we began. Instead, we help the client recognize the unaccepted truth about himself, that he is capable of envious or murderous desires, or that he is in need of skillful psychiatric care. A pandemoniac theology which takes a tendency like envy or murderous thoughts and changes it into an entity like the spirit of murder is infantile and regressive. Pride or anger or lust cannot exist on their own without proud or angry or lustful people. If we suggest otherwise, we are simply allowing people to hold onto their projection mechanisms instead of recognizing them for what they are and getting assistance in dealing with them. Am I saying, then, that there are no such things as alien intelligent entities, and that the exorcism of a possessing spirit is an inappropriate strategy? No. At least, not in every case. Admittedly, people who think they are possessed often are not, and most people who ask for exorcism do not need it. There is a high percentage of cases which have possession as a presenting symptom, but which need the resources of conventional medicine to deal with the real and underlying cause of the dysfunction. But that, though true, is less than the whole truth. Mediumship, if we accept its prima facie explanation, at least in some cases, shows us that it is possible for a person to be controlled by a discarnate human entity. Channeling or prophecy or inspiration, again if we take them for what they appear to be, show that it is similarly possible to be influenced by non-human agents, whether these are of a subhuman or a superhuman variety. Students of theology are divided as to whether there are such entities as angels or demons. Traditionalists believe in a creation which includes superhuman beings normally invisible to our eyes, one of whom rebelled against his creator and set up a rival kingdom populated by those members of the heavenly hierarchy who were prepared to come with him. Others believe that that kind of explanation is inescapably mythological and poetical, and not to be taken literally. They paint a more humanistic scenario. On their view, when wrong things are done by men and women, their evil somehow takes on an existence of its own, a derivative and secondary existence, but a quasi-independent one, so that the evil conglomerates into pseudo-personalities. It is unlikely that these are permanent entities in a rigidly defined demonic hierarchy of command and obedience. It seems more likely that the entities are as temporary as the eddying whirlpools in a bubbling cesspit. Evil cannot rise to accept the discipline of obedience, except for self-regarding and temporary ends, so that any appearance of command and obedience is purely short-lived and opportunistic. But whilst these conglomerations exist and whilst they can be mistaken for more permanent entities, there is something about them which is prima facie attractive to human beings. If we stop and reflect, we see how unsatisfying are the inducements they offer us. Sadly, we do not often reflect. So, when they offer gratification without effort, or comfort without commitment, or power without responsibility, we are fooled. And once we allow a foothold, the evil gets a firmer grip. Temptation is addictive. Every time it is accepted, the pseudo-personality reinforces its existence. Now we are on the slippery slope. Temptation accepted leads to obsession, and obsession, if nothing is done about it, shades into a position in which the client has taken on the lineaments of the evil entity. He is no longer master of his own fate. He does not even want to escape. He has become possessed. If that is a true description of an actual process, then possession is a possibility and exorcism a necessity. But remember that possession is only one possibility and that diagnosis is important. Many things which look like the activity of spirits may not be, and, conversely, some things which look as if they have a purely physical and even pharmacological cause can be interpreted as the activity of alien intelligent entities. The poltergeist, for instance, literally and etymologically means a noisy spirit. Frequently, it is nothing of the sort, but is the externalization of interpersonal tensions within a household or work situation is. Some poltergeist manifestations may be due to the activity of discarnate humans, as, for example, a former owner of a house who is expressing disapproval of the changes made by its new occupants, but in practice, the humanistic rather than the spiritualistic explanation seems more often to fit the case better and to lead to a more easy resolution of the situation. Conversely, Professor Cedric Wilson has recently argued that allergic reactions may be precipitated in patients by the activity of alien intelligent entities, and that he can, by a pendulum dowsing method, not only differentiate between entity possession and multiple personality disorder, but also desensitize the allergen and send the causative entity packing. In other words, that he can tell whether an allergy is caused by a discarnate human being or not, and, if it is, he can exorcise the patient so afflicted. Diagnosis in this whole field is always difficult, except, apparently, for Professor Wilson. So often it owes more to the metaphysical beliefs of the practitioner than to any objective criteria. Thus, there are those who believe that demons fill the very air we breathe and that anyone who does not watch out for them can get a very nasty dose simply by being alive. At the opposite pole are those who hold that demons are a mythological and pre-scientific description of phenomena which are nowadays conceived quite differently. Some diagnostic criteria are, however, fairly clear. For example, if a client's troubles began with the hearing of obscene voices which became more and more intrusive as time went on, or with the conviction that he was under telepathic attack by unseen forces, it is likely that the psychiatrist will be able to do him more good than the priest, though don't forget that both psychiatrist and priest may be needed if total health is to be restored. But if the trouble started because the person was unhealthily interested in occultism, or was a member of a coven, or had practical experience of witchcraft or Satanism, or if he has played around with the Ouija board, or practiced automatic writing or had experimented with mediumship, then we might be on to something different. At all events, such a prehistory in a troubled client should warn us to keep our diagnostic options open. Please note that I am not saying that automatic writing or mediumship are in themselves either satanic or psychically dangerous. I am speaking of clients who are in trouble and who come to a practitioner for help, and whose trouble may be linked with their psychic experimentation. Some psychic practices involve letting the censorship which the conscious mind normally imposes on the subconscious slip its guard. Therefore, there is the possibility either of projection, as already mentioned, or of allowing undesirable entities to slip in and start causing trouble. In most cases, this does not happen. Some people, however, are prone to dangers of this sort and cannot cope with them. It is a little like the way in which most people are able to cope with alcohol and find it a useful social lubricant and a help to relaxation, but there are some people for whom alcohol is a dangerous drug and leads to addiction even if taken in small doses. Just as the alcoholic must eschew even the smallest amount of alcohol if he is to remain out of trouble, so the person who cannot control his psychic faculty must give up the exercise of it. One way or another, then, we have a person in spiritual trouble, the kind of trouble that can end up as possession. What can we do to help? If we are called in early on, we may simply need to counsel the client about how to deal with temptations. That will include advice about avoiding occasions of sin, of living the recollected life, of arrow prayers, or the grasping hold of a little wooden cross kept in the pocket, or of making the sign of the cross over the body, or of using the Lord's Prayer, and deliver us from the evil one, or St. Patrick's breastplate, or the phrase under the protection. Not that this advice should suggest that a Lone Ranger campaign is sufficient. We are part of Christ's body, the Church, and we act corporately. The person who finds temptation recurrent, insidious, and plausible will need to tackle it with help, rather than on his own. Certainly if the trouble has become obsessive, there will be the need to involve Christian groups with the sufferer in an attempt to break the obsession. It is an addiction, and methods similar to those of the group therapy of Alcoholics Anonymous are of great value. But maybe it has gone further, and the client is past helping himself. Indeed, he may be brought by his friends simply because they see he is not even capable of wishing to be freed from the possessing influence. It is as if an entity has taken charge. According to some theological perspectives, it is the fact that an entity has taken charge and needs to be expelled. In the Church of England, an exorcism of this sort cannot be carried out without the permission of the bishop, and it has to be done by the team he has authorized to do it. Other churches have their own rules. Abide by them. They depend on the particular theological perspective of that particular church, but they have been worked out in practice and they will ensure that the treatment is carried out by persons who have had experience of this specialized ministry. Do not imagine that all that is needed to do the trick is the application of a formula of exorcism or the use of a service of exorcism or the experience of having been treated by an exorcist. It needs more than a chew of garlic or the waving of a crucifix to banish the works of the devil from this world. Admittedly, the trauma of going through a form of exorcism may give a big enough shock to the system to enable a rescue, or a cure, or deliverance, to be effected, but that is only the very beginning. The way back to normality is as hard as that of the drug addict, and anyone who suggests otherwise is simply underrating the seriousness of the whole business. The great insight is the one we have from Jesus himself. If one devil is cast out and a vacuum left in its place, nature abhors that vacuum and 7 worse devils will speed in to take its place. Only if that vacuum is filled will there be any chance of a permanent cure. It can be filled by Christian companionship, Christian nurture, Christian prayer and worship, Christian love and compassion, the wholesomeness of Christian thoughts, in brief, with Christ himself, so that the delivered person is integrated into the spirit-filled life of the community which knows the freedom which Jesus Christ brings. It is a multidisciplinary effort. Often, the sufferer has entered the drug world as well as a malevolent subculture whose norms are the exact opposite of those held by civilized, let alone Christian, society, so there often needs to be a blend of medical science, psychological insight, and Christian pastoral care. But if things go well, the person who once was filled with evil will be able not only to endure but also to delight in what Watchman Nee used to call the normal Christian life. Perhaps what I have said so far will suffice to dispose of the old canard that all exorcism is a cop-out for those who don't want to be held responsible for their moral lapses. Admittedly, there will always be people around who try to use that excuse. It wasn't my fault. It was the devil that possessed me. I don't know what got into me, but... Exorcism is only appropriate at the final stage of a long process when the sufferer is beyond being able to help himself. At any earlier stage, he has to take responsibility for his own moral struggle and to take the blame for his lapses. Indeed, even at the last stage, after he has been cured, he will realize that it was culpable of him to allow himself to begin the downward primrose path and not to heed the warnings. Of course, it may have been more a matter of ignorance of the true dangers, or of folly and immaturity rather than sheer culpable wickedness. The moral theologian and pastor will take all the circumstances into account before he thinks of quantifying the blame. But he certainly won't allow a person to say, "It was the devil who made me do it," when he is at the stage at which he ought to be saying, "It is the devil who wants me to do this, and I am one finding it very hard to say no to him." Finally, however, let me say that deliverance is possible. Whether it succeeds because an invading entity has been cast out, or whether it succeeds because the patient and the therapist both believe that an invading entity has been cast out, whereas all that has happened is that a psychological dysfunction has been put right by the placebo effect, doesn't too greatly matter. What matters is that a son or daughter of God who was in bondage has been freed into the glorious liberty which ought to be that person's birthright. Possession may be 9/10 of the law, but deliverance needs the whole of the gospel, applied with precision to every individual's unique predicament, including materia medica as well as counseling, liturgy, and the exercise of the authority of Jesus Christ. When all has been said and done, to him be the glory.
You have been listening to Talking Point from the Church's Fellowship for Psychical and Spiritual Studies. To find out more, please visit www.churchesfellowship.co.uk.